Welcome to this week's edition of the Medical Center Show. Today we have a great primary care physician, one of our premier primary care physicians on staff, Dr. Chinai, and we have lots of great topics to talk about. We'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state. #1 for high-risk pregnancy. #1 for neurological disorders. #1 for stroke. Magnet Award for nursing excellence. A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center.
Welcome back, Dr. Chinai. So glad to have you here this week.
Good afternoon, Joe.
Tell us a little bit about yourself. You're practicing in Jersey City. You have a couple different offices, but tell us about your education and training first.
Education-wise, I graduated in 1999 from Ross University School of Medicine. After that, I pursued a residency in internal medicine at St. Barnabas Medical Center in Livingston, New Jersey.
Part of our new family, huh?
Yes, part of our new family.
Okay.
And good to be back with the old family.
There you go, that's right.
So it should be bringing a lot of new exciting changes and addition to services on top of what we have already, which is great.
Yeah.
And upon completion of my residency at St. Barnabas, I started a chief residency in 2003 at Jersey City Medical Center.
Okay, so you are one of our premier doctors, graduates from our program. That's
absolutely.
Great.
And proud of it.
Yeah,
and,
absolutely.
Glad to say it was one of the most unique experiences of my training, because we were there at the time of the transition from the old medical center to the new medical center.
You actually helped us move into the new building.
Yes,
wow.
It was very exciting and great learning experience.
Sure. So you ended up in Jersey City. After going to Barnabas for your residency, you decided to stay in Jersey City. And you have a couple of practices in our community.
The original practice that we have, we started it on the waterfront at 610 Washington Boulevard in the James Madison building.
Okay.
And after having that practice build up, we opened another location at 129 Newark Avenue by the Grove Street Path Station.
Right by the path there, right up the street from there.
Correct.
That's right. That's a great office location.
I think both of them are great locations. They are very easily accessible to a lot of patients, especially considering the foot traffic in Jersey City and all the redevelopment that has gone on in the last 10 years. It's been
Now, it's not just you in this practice, right? Don't you have a whole host of doctors that you work with?
We do. We have, it's a very large office, about 6,000 square feet with specialty supports such as gastroenterology, cardiology, pulmonology.
And that's right up from the Grove Street Path, right?
It's about half a block from the Grove Street Path station on the left there. And it's a beautifully constructed modern office with all the amenities and electronic medical records, everything built in. And
so not only primary care, but you can see a gastroenterologist there, pain management,
Absolutely. Physical therapy.
physical therapy. Wow, it's kind of like
we even have a dentist that's in-house.
Wow,
So,
so-
it's a one-stop shop for
Wow.
patients, and it's also great for delivering state-of-the-art medical care for the patients.
right. Now, some of your other doctors, some of your other primary care doctors who work with you?
At my Newark Avenue location, we have Dr. Agron Alezi,
Right.
who's also a
Oh, yeah, he's a graduate. That's right.
of Jersey City Medical Center. He's been working with me for 3 years there. At the Washington Boulevard location, we have Dr. Luhana,
All right. Okay.
Dr. Pranay Bhatt,
Okay.
Dr. Ganga Swamiya, and we hired another junior doctor at that location this year, Dr. Mamedwar.
Okay. So there's quite a number of doctors there. People just walk in, or they call for an appointment. What usually happens?
It's a
with your
little bit
practice?
different for both locations.
Okay.
Newark Avenue location, we have a lot more walk-ins,
Right.
and we still have patients that schedule appointments, but we have a lot of walk-ins because the amount of foot traffic around that area is tremendous.
Right.
And at the 610 Walt location, it's mostly by appointments.
Mostly by appointments. Okay. So in your practice as a primary care physician, you must see a whole variety of things. What's kind of some of the common things that people come in to your practice for?
I think, we see everything from acute care issues such as coughs and colds and belly aches and back pains, but most of the things we see in the practice are, preventive care issues such as, and disease management issues such as hypertension, diabetes, asthma, lots of nutritional and vitamin deficiency,
Okay.
which is a little bit unusual for,
Yeah,
very
right. Well, let's talk a little bit about vitamin deficiency. So you sometimes see even young people come in with vitamin deficiencies?
I think about 90% of the patients we see for routine blood testing and physicals and things like that, they turn out to be deficient in at least 2 very common vitamins.
Really? And which two are they?
Typically, they're very deficient in vitamin B12 and vitamin D.
Wow. And any particular reason why those two? I mean, they're just not eating the right foods, or?
I think it's multifactorial. The vitamin B12 deficiency, I believe, is mostly because of malabsorption and not adequate intake.
Okay.
A lot of our patients in the Washington Boulevard location are vegetarian.
So talk about, you said not absorbing it. So in other words, when they eat their food, they don't have the opportunity to absorb that particular vitamin?
That's correct.
Why would that happen?
It happens for a few different reasons. Number one, it's a lot of our clients have very high-stress jobs. They have
they work on Wall Street and all that, right?
Right. They are big IT guys, they are finance guys, they are
Right.
marketing guys.
Sure.
And they have a lot of inflammation in their stomach lining.
Okay.
And that prevents the B12 from being absorbed properly.
Wow.
So, and there are other patients that have other issues,
Sure.
some autoimmune issues that prevent them from absorbing B12.
So autoimmune meaning their own body's kind of fighting what
Their own body is making certain proteins that prevent the absorption of B12 through their gastrointestinal tract.
Yeah. So how would somebody know, like B12 deficiency? Are there things that happen to people because they don't have enough vitamin B12?
Yeah, the B12 is very essential for stamina,
Right.
and for proper functioning of nerves.
Okay.
Basically, if you think of B12 and if you think of an electrical wire, there is an insulation that the body makes around the electrical wire to make the nerves fire more properly.
Okay.
If you don't have enough B12, the myelin sheath, which is the insulation that goes around the nerves, is not formed properly.
Oh.
So the electrical current that basically controls all the activity in the body kind of tends to slow down.
Okay.
So people feel fatigued towards the end of the day.
Sluggish.
Their capacity to process information slows down. Their capacity to
And these are a lot of people who have to think quickly, right, in the kind of jobs that they do?
most of them do.
Wow.
So
Wow.
which is a big problem.
And you detect that just from a simple blood test?
Just from a simple blood test. Most of the time when they come in for their routine physical, or if they come in with complaints of fatigue and not being able to process information, getting tired easily, this is part of the routine blood test that we
Wow.
run.
Well, we'll be right back to talk about vitamin D deficiency.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Dr. Chinai. Dr. Chinai has 2 offices in Jersey City and a whole host of specialties that are provided in his office. So we were talking a little bit about vitamin deficiency, and the other one you mentioned was vitamin D.
Right.
So what are the consequences of having a vitamin D deficiency?
I mean, vitamin D controls a few things in your body. It controls homeostasis of calcium and phosphate.
Okay.
Vitamin D is very important in building of bones.
Okay.
So, and also for proper functioning of your muscles.
Right.
Because most of the chemical reactions that take place that drive the muscles to work are mediated by calcium channels in the body, and the energy that's used is in the form of phosphate compounds.
Okay.
So if you don't have enough vitamin D, obviously it can lead to premature osteoporosis in the future, which is big problem. People can have early breakage of their bones and hips. And
Is that mostly a problem in women?
it's a problem in both men and women. There's
okay.
also an entity called male andropause,
Right.
where men reach a certain age and their hormone levels tend to decline, and if they have not built up a sufficient amount of bone mass at that point, they can also become osteoporotic.
Wow.
To a lesser degree, but problem for both sexes.
Right. And is that because they're not absorbing the vitamin like we talked about with vitamin B, or?
I think mostly vitamin D, it's a dietary issue.
Okay.
Most people don't consume enough vitamin D in their diet. I think some of the guidelines that were put forth in the past, where you had you were taking 400 to 800 IU of vitamin D in your diet,
Right.
is minuscule compared to what the body truly requires.
Oh, I see. Okay.
So,
and where do you get vitamin D from?
from certain foods,
Right.
mainly dairy products.
Okay.
But once again, most of the vitamin D that's in those food products is inactive vitamin D.
Right.
And one of the biggest problem that we see, even with a lot of our adolescent population, is nobody sees the light of day anymore.
Right.
Most people, in this
Oh,
neighborhood,
and you
they
need
are
sunlight to activate the vitamin D?
Correct.
Wow.
and most
Wow.
people are working indoors all day.
Yeah.
Even the kids these days, it's
Sure.
not like when we were young, we were
Yeah.
outside playing in the
Yeah.
sun doing things. Most of them are these days inside playing on their Xbox or other gadgets, and they just don't get
Wow.
sufficient amount
So
of
there's
sun.
2 factors, right? You've got the one where you're not just taking enough in, but 2, activating it by the sunshine is also
Correct.
important.
Yeah, you need about 15 minutes of full body exposure daily
Wow.
to activate enough vitamin D in your body.
Okay. So you said osteoporosis is a problem. I often hear people talk about, during the winter, they kind of feel down. And that vitamin D has something to do with that?
It has a host of things that it does in the body. It's
Mm-hmm.
one of the what we call super vitamins that not only has to do with calcium and phosphate and bone production, but it also unlocks a lot of genes.
Oh, okay.
So it unlocks a lot of genes in terms of cancer prevention.
Wow.
It unlocks a lot of genes in terms of reducing the incidence of asthma, which is a very big problem in urban populations.
Sure.
So it raises something called natural killer cells in the body,
Okay.
which wipes out precancerous cells that are circulating in the body.
Right.
So it has a very, very big function as far as preventing a whole host of other diseases,
Right.
including depression, which is something that's common in the Northeast when we have very little sun in the
Yeah, I mean, it seems like, you start to say, oh, man, I'm really feeling down after all these cloudy days, right?
Right.
And a little bit of vitamin D might even help that, huh?
I think it's a very important vitamin to supplement and very aggressively.
Wow. So we talked a little bit about vitamin B12 before. Do you just take a pill then? How do you treat vitamin B12 and vitamin D deficiency?
It depends on the underlying cause of your malabsorption.
Right.
If you have gastric inflammation or if you have other autoimmune issues, what we typically like to do is if you are very, very low, we usually supplement by injections for the first week or so.
All right.
And then we
So what, every day they come in for an injection or once a week?
Usually every alternate day they come for injections. We give anywhere from 3 to 5 injections to bring the patients back to the levels where they should be.
And then do you measure their levels after you give them the injections, or is it necessary?
Typically not. Typically we wait until about 6 months that after the injections we put them on some sort of either oral supplement or they even have sublingual supplements which go under the tongue now, which absorb very well. They even have intranasal sprays which of B12 which absorb beautifully. So it's up to
what the patient's
up to the patient and how frequently we want to dose them.
And after they get these shots, do people tell you that they feel better almost immediately?
Typically about a month or so.
Really?
Before, some people we have a very quick response that within a week after they're done with the shots, they feel typically more energetic right away.
Right.
And then the rest of the things that they're experiencing, if they were having any neurological changes or if they were having other issues, mental cloudiness, all of that, about a month or so, once we started replacing all of these things, they start generally feeling much better.
That's really amazing. Now, how about vitamin D? That's not an injection, right? Do you usually take pills?
Not in this country.
Yeah, not in this country. There you go.
So in Europe and certain other countries, vitamin D is available as an injection, but not here.
All right.
So here we typically use very high dose once a week tablet.
Okay.
Generally I tell the patients to take it every Sunday after they eat lunch.
Right.
And we do that for about 6 months, and at that point we check their levels, and then we put them on a smaller maintenance dose of vitamin D daily.
Okay. And how much vitamin D do they take, once a week or?
With the once a week preparation, we give them 50,000 international units.
And they just do it one time.
And they do it one time. It's convenient.
Yeah.
Most of my patients have gadgets, so I tell them to put it on their,
on their
phones
schedule.
or smartphones as a reminder to take it.
That's very, very funny.
Yeah.
Any other vitamin issues that you see in your or vitamin related issues?
I think those are the two main ones,
Okay.
and then some of the other things are nutritional deficiencies with iron and other nutritional issues that revolve around.
And even in young people, right? I mean, it's not just old people that end up with these vitamin deficiencies.
No, it's very, very common in young people to an alarming rate.
Right.
Like I said, almost 90% of our patients that we see that come for routine blood tests, we find them to be deficient in vitamin D.
All right, I'm coming to get my blood tested to see if
Absolutely.
I got vitamin B12 or vitamin D deficiency.
Yeah.
And you have 2 convenient locations, right? And one
it's
on
great.
Washington
And
Boulevard.
we typically try to accommodate everybody
Right.
the same day.
Good.
If it's an emergency, you don't have to wait for a week or 2 weeks to see us. We usually fit you in one of our 2 locations.
Wow.
And we are open from 8 in the morning till 8 in the evening, and
you
we
are?
have
Great.
Saturday hours, and so it's
Good.
very
So
convenient
it's very convenient for everybody. Okay, great. Well, we'll be right back to talk more about some of our primary care issues.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back. We're here with Dr. Chinai, one of our premier primary care physicians at Jersey City Medical Center. Dr. Chinai, one of the things that I see just walking through our community, because I live in Jersey City, a lot of people who seem to be overweight. You see a lot of patients with obesity?
I think that's probably one of the major obstacles and diseases that we tackle in our practice.
Really?
Is, if you statistically look at it, I think almost 31.8% of all Americans are classified as obese.
Wow.
And that carries a whole host of medical issues that come as a result of that obesity.
Right.
So typically hypertension, diabetes, sleep apnea. So all of these things.
And again, even young people, right? I mean, you see it in young people.
It's at an alarming rate in young people.
Right.
And it's going to bring a lot of new chronic diseases at a much higher incidence rate than we have seen in the past.
So it's got to be a sensitive issue when somebody comes in and they're obese and you start talking to them about their weight. I mean, how do you approach that? I mean, because you want to be sensitive to their needs, but it's got to be...
I think it's very important not to, stigmatize anybody. It's very important that when you sit down with the patient that you take a very careful history to see what the possible issues are as far as why they have either failed on a dietary regimen or why they got to the point where they got to, and to see if you can concentrate your efforts on simplifying things for the patients that they can do to help them lose weight or help them get their diabetes under control, and use a variety of methods that work with them.
Yeah. I would imagine that one of the issues you must see is like somebody gets hurt, they have some kind of injury, not able to exercise anymore, and all of a sudden they find themselves gaining weight. Now you have physical therapy in your office,
yes.
So sometimes you prescribe that to kind of help them kind of get themselves back on track?
Some of the patients, yes, we prescribe them physical therapy. Sometimes we design entire dietary regimens and exercise regimens that they can start. Usually, depending on what their baseline level is, sometimes we even send them for, cardiac evaluation and other things before we put them on any exercise regimen to make sure that their, system is able to handle it, that their heart is healthy enough, that their lungs are healthy enough to start an exercise program.
Okay.
So, and, all of these things come as a package when we work with medical center to accomplish all of these things, including all the testing and everything that goes on.
Okay, great. So you really can help people kind of lose weight when they come in and really help them medically understand why it's important for them to do that.
I mean, there's a variety of ways we can help them. One of the things, like I said, is dietary. Second thing is for our morbidly obese patients that, fail on, diets or other modalities that we've tried.
Okay, so make sure people understand, morbidly obese, what does that mean?
Basically, they are, more than X amount of pounds overweight that...
Oh, I see. So for somebody who's 5'10",
somebody who's 5'10", if they're
weighs 300 pounds,
that's a problem.
Yeah.
And those patients typically, if they have not responded to medications, not responded to dietary modifications, and then we even have surgical procedures that we refer them to medical center that help them lose weight, and we have had amazing success with those patients also.
And then after they have their surgery, do you follow up with them, making sure they get the right nutrition?
Absolutely, and even the nutritional issue becomes even more important after the surgery because they become even more deficient in certain basic vitamins because they are not able to absorb them. But we work very closely with the surgeons there.
With the bariatric surgeons.
With the bariatric surgeons, and they have done.
I've heard some really great outcomes from patients who've had their surgeries at our place.
I have had patients on 3 different diabetes medications, and post-surgery, after 2 weeks, 3 weeks, they are basically not on any diabetes medications at all.
Wow.
And it's great.
Wow, that's amazing.